I'm going to share a story with you about my dad, who in April of 2008 was diagnosed with hepatocellular carcinoma, which is primary liver cancer. At that point in my dad's life when he was diagnosed, his life changed forever, and so did all of ours. My dad's medical care here in the Lansing area has entailed a liver or gastroenterology specialist, 2 cardiac specialists, a neurologist, an ENT doctor, an oncologist, an internal medicine practitioner, in addition to his family practice physician. One of the most difficult issues that we began to experience after his diagnosis in 2008 was in working with area healthcare providers and health systems. The records were not getting to all the doctors that I just mentioned that were treating him. I began to see that tests were being duplicated because doctors didn't have access to all his records and consultations with each other. I decided at that point that I needed to have all the doctors copy me on all records and tests. And within a 4-month time period, my dad's medical records were over 1.5 paper boxes, the cases that the paper comes in, full of records. I had them all organized in brown envelopes by date, by physician, by whatever treatment facility it was that day, so I could easily pull them out. I regularly was copying these records that we had for consultations and tests, and I would either hand deliver, and still do, or mail them to some of the physicians treating him. It's just unbelievable, all the paper that there is for his care. One evening in August 2008, my dad was having significant issues and we had to call the paramedics. Unfortunately, earlier that day, I had taken the records out of my car and they were in my house. And I had to hurry and follow the ambulance, so I didn't have time to go from my dad's house to my house to get the records. I had to call my husband to bring the records from our home to the ER where my dad was taken. Those records that were brought there that night saved my dad unnecessary medical procedures, unnecessary duplication of tests, some of which he had had earlier that morning with an area physician. So, excuse me just a second. My point that I want to make is this, is that I can only imagine that if all health records were available to all hospitals, doctors, and treating facilities all the time, what a savings in time and medical dollars that could be. But more importantly, I imagine that better care to the patient, and perhaps even saving a life. All known drug allergies would be readily available to all doctors in that portable health record. All their current medications that are being used would also be in that permanent record that goes with that patient. And you could also avoid drug interactions and over-medicating. And these are all things that I had experienced with my dad in the last 1.5 years. As a non-medical person, I see a portable health record as an invaluable resource for patients and healthcare professionals who treat and care for them. I commend Dr. McCardle and the Capital Area Rio for their timeless efforts and fortitude in bringing portable health records to the Mid-Michigan community here in Lansing. And I am so pleased to be able to be here today to share my dad's story and our family's story with all of you. Thank you.